World Malaria Day is being observed today. Malaria is preventable and treatable, yet it claims hundreds of thousands of lives each year. Nigeria has more cases of malaria and malaria deaths than anywhere else in the world. The fight against the disease in Africa's most populous country is still facing challenges. Despite programs geared towards the elimination of malaria, health experts say that higher quality healthcare needs to be available to all Nigerians in order to fully address the challenge. DD India's correspondent Ajak Mangut gets us more.
Fatima Abubakar lives with her family in this small community in Abuja. She says her children often get malaria due to their poor living conditions.
I have young kids, and sometimes I'll have two of them getting malaria at the same time in a month, or one child falling ill twice a month. And that's because we have a lot of mosquitoes here. It's not easy having to deal with that.
Malaria is a disease caused by female mosquitoes found in areas with stagnant water and an unclean environment. Children under 5 are the most vulnerable to the disease. The World Health Organization says Africa is disproportionately affected by the disease.
Health authorities in Nigeria say an estimated 55 million malaria cases and nearly 90,000 malaria deaths occur in the country every year. The World Health Organization also says the risk of transmission exists across Nigeria all year round.
For years, Nigeria, through its National Elimination Program, has been working to lessen the burden of the disease through prevention and treatment, policies and guidelines. But health experts say poor funding, insecurity and the COVID-19 pandemic has slowed progress.
It's been a tough one managing malaria in the country. It's some progress and then some regression. The program, the National Malaria Elimination Program, tries to look at control from different angles. Vector control, appropriate treatment, diagnosis and treatment, chemo prevention, and the monitoring and evaluation, as it may be. So all those have challenges. There are a lot of inequity in even reaching the real needy population for malaria. For example, the burden is more in the rural area, amongst the lower socioeconomic group, in the Sahel region, and then with all the insecurity and all those or whatnot happening in those places. So that was a delay.
Health experts argue that the government should look at guaranteeing access to quality health care, especially in rural areas. They say this will help in providing care for malaria cases and all other diseases the country is grappling with.
The system has to be such that there is access to care, especially for vulnerable and hard-to-reach places and people. People in the rural area, we must revamp our primary healthcare system, retrain our healthcare workers, so they could use the latest and recognized treatment protocols for malaria. And then we have to make healthcare access readily available for our people in the rural area.
The government says it wants to start rolling out vaccines for malaria before the end of 2024, with a target to reduce malaria prevalence by 2025. Also in April, it announced plans to improve facilities in 17,000 primary healthcare centers and establish over 8,000 new ones to improve access to quality health care. But those aims require time and significant funding. For now, Fatima is doing what she can to try and protect her children from malaria. Ajak Mangut in Abuja, reporting for DD India.